Hello, my name is Dr. Jonathan Stockman, and I'm a veterinary nutritionist. And today I will be talking about nutritional management of urinary and renal disease. So the objectives for today are to understand the risk factors, the prevalence and metabolic implications, as well as the nutritional management of chronic kidney disease and lower urinary disease in dogs and cats. But before we start talking about urinary disease and renal disease, I just want to cover a little bit about calcium and phosphorus metabolism because it's important for the further understanding of some of the metabolic processes that occur during urinary disease and renal disease. So when phosphorus is high, we have several mechanisms to get it to go down again, including the secretion of a hormone called the parathyroid hormone, or PTH. And what PTH does is it reduces the absorption of calcium and phosphorus from the diet, and it increases the excretion of phosphorus in the urine. When we have hyperphosphatemia, it also upregulates this factor called fibroblast growth factor 23, which is excreted from the bones. And this factor acts to reduce the activation of vitamin D to calcitriol in the kidney. By doing that, it reduces the absorption of calcium and phosphorus from the diet. But what the primary function of FGF23 is, it is a hormone that binds with a factor called klotho in the kidneys and stimulates the excretion of phosphorus from the kidneys into the urinary filtrate. When we have chronic kidney disease, however, PTH is unable to cause excretion of phosphorus in the urine, as well as FGF23. And as a result of that, we have FGF23 that is increasing and PTH that are increasing to try and mitigate the increase in phosphorus, but there is no ability to excrete the excess phosphorus in the urine. So what happens is that FGF23 and PTH are going to be both high. And one of the functions of PTH is to break down bones to release calcium and phosphorus into the circulation. But when we have kidney disease, there isn't really this feedback mechanism to have PTH go back down again, and PTH will remain high and continue break down bones